Come in.
Hello, my name is Rosaline. I am a USU F&P student, and today I will be doing a abdominal assessment on you. What is your name?
Ugo.
Ugo? Okay. And what is your last name?
Campo.
Campo. Ugo Campo. And how do you want me to refer to you?
My pronouns are she and her.
She and her. Okay. Before we get started on this video, I would like to get your consent. This video will be uploaded to YouTube, and it will be downloaded as unlisted so that my instructor can grade. Is that okay with you? Do I have your consent?
Yes.
Okay, great. Then I would sanitize my hand and start the assessment. So before I start the assessment, I would have my patient comfortable. Her head is on the pillow. Then I would then take another pillow and place it under her legs. You can lift your legs for me. Okay, make sure that she's comfortable. Are you comfortable? Is it too cold for you, or is it too hot, or?
Nope, this is great.
Okay, great. The first thing we'll be doing is doing an inspection, and first I would have you lift if you can lift your shirt for me up so to expose your abdomen. All right, so the first thing I'll be doing is inspecting. On inspection, I'll be looking for the contour of the abdomen. There's no distension noted. I don't note any rash on the abdomen, no moles. The skin is nice. There's no discoloration of the skin, no bruising. I will also look at the sclera for any jaundice or yellowing of the white of the eyes, which is not noted. Secondly, after inspecting the abdomen, I will then, okay, looking at the navel, and I'm sorry, I'm just going to place my hands here just to look at the navel. The navel is midline, which is a normal finding. Then I will then auscultate using my stethoscope. I will auscultate in all four quadrants, the right and the lower quadrants, and then the right and lower upper quadrants. Okay, and I will auscultate using my diaphragm. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I did that with my diaphragm. Now I'm going to auscultate with my bell in all four quadrants. Right lower quadrant, right upper quadrant with bell, left upper quadrant, left lower quadrant. I will then assess the aorta, and the aorta is below the epigastrum, above the umbilicus, more towards the left. And I will be listening with my diaphragm and also with my bell. I will then listen to the renal arteries with my diaphragm and also with my bell. So the right renal artery, the left renal artery with my diaphragm and with my bell. Then the iliac artery on the right side with my diaphragm and also with my bell. I will also listen to the iliac artery on the left with my diaphragm and with my bell. Then I would listen to the femoral arteries using the diaphragm and also the bell. And on the right side, right femoral artery with my diaphragm and with my bell. This auscultation. After auscultating, then I would percuss. And with percussion, I would percuss in all four quadrants as well. I would use my non-dominant hand, place it on the patient's abdomen, and using my dominant hand, I will tap for tympany or dullness. Tympany should be heard in all quadrants because it is air filled. If there is tympany, then that would be an abnormal finding. So. I will also percuss the bladder. And when we're percussing the bladder, we would hear tympany because it's also air filled. If I hear any dullness, that means that the bladder may be full or there might be a mass there, that mass would be an abnormal finding. Then I will percuss the liver. I'm going to put your shirt up a little bit more. Okay, so I would percuss the liver border. And I don't feel anything because it's not enlarged or anything. Then I would go over to the spleen area. So I would come mid-clavicular and percuss for the spleen. And I should hear dullness because of the ribs. The spleen is under the ribs. It's under the ribs, so there's no sign of enlargement. If it was enlarged, I might have been able to feel it, but it's not, so that's a normal sign. Then I would percuss the liver span. I would measure from the right lower quadrant. Okay. Tympany, tympany, tympany. And here is where I hear the dullness. So I would mark here. Then I would start at this. I would measure from the upper part of the rib cage. Resonance, resonance, resonance. Here is where I hear the dullness. So I would measure the space in between where I first felt the dullness and the second part of the dullness, and I would measure. That would be the liver span. The normal liver span is between 6 and 12, and for this patient, it is about 7 centimeters. Once I'm done percussing, we will then go to palpation. And palpation, we'll start off with the softer, light palpation. I would do that with one hand in all 4 quadrants of the abdomen and see if the patient has any pain. This also gets the patient, have the patient relax a little bit instead of going directly into deep palpation. So I would lightly palpate. Any pain?
No.
Okay. The right upper quadrant, any pain?
No.
Left upper quadrant, any pain?
No.
Left lower quadrant, any pain?
No.
Okay. Then I would do the deep palpation with both hands in all 4 quadrants. Okay. Any pain?
No.
Okay. Any pain in the right upper?
No.
Any pain in the left upper?
No.
Any pain?
No.
Okay, so there's no pain with the palpation, the deep palpation, which is a good sign. If the patient had pain in either quadrants, I would do that side last so that I don't hurt the patient any further. Now I would be doing the specialty test. Specialty test, we would be testing for the specialty test, I would be checking for the fluid wave test. The fluid wave test, we would test for any fluid shifts in the abdomen. So I would ask the patient to place her hand up here for me on the abdomen, laterally here. Then I would push one side of the abdomen and hold with my opposite arm. When I push the fluids towards the right, I don't see any fluid shift. Then I would also do the same for the left side. I would push with one hand to see if there is any fluids in the opposite side, which is none noted. That's good. Bring the arms back here for me. Then I would also have the patient, I would palpate, I forgot to palpate the liver and the spleen with inspiration, so I'll do that at this time. So if you can inhale for me, and then I'll press, feeling that liver. Okay, that is normal. Exhale for me. Okay, then I would do the same for the spleen. I would have her inhale. Take a deep breath for me. Very good. To see if I feel that spleen, which I don't feel, which is a normal finding. Then we would go into a few other specialty tests. One of the tests that we would be checking for, we would do the Murphy sign. The Murphy sign will let us know if the patient is having any inflammation in the gallbladder. So I would apply pressure to her right upper quadrant, and if I press and she's having pain, that may be a sign that the patient is having some inflammation or cholecystitis. So I'm going to press on your abdomen here. Let me know if there's any pain when I press, okay? Okay, any pain?
No.
Okay, great, lift up. There's no pain, right?
No pain.
Okay, great. So that McBurney's point is negative. There's no pain. Then I would also do a roving sign. The roving sign will let us know if there is some inflammation in the appendix or in the peritoneum somewhere. So rovings, I would apply pressure to the left side, the left lower quadrant of the patient's abdomen. Are you feeling any pain when I press down? So there's no pain. If I remove my hand and the patient says there is referred pain after lifting, then that would be a positive roving sign. So lift up my hand. Are you feeling any pressure?
No.
No pressure. Okay, so that test is for rovings is negative. Once I'm done doing those specialty tests, I will also test for costal vertebral angle tenderness. So I have my patient sit up. Thank you. Okay, and with the for costal vertebral tenderness, I would count from the 12th rib up, place my hands. Okay, 12th rib, go up, place my hands on the patient's spine area. Then I would tap twice. Any tenderness?
No.
Okay, so that is negative. There's no tenderness on the right side. Then I would go to the patient's left side and do the same thing. From the 12th rib, I would place my hands in this area here to check for costal vertebral tenderness. Any pain?
No.
And that is negative. Okay, that completes the assessment on the abdomen. Thank you for your time. Thank you. How was that?